Welcome back to the OHSU Effect Inside Health and Science. Do you have a hard time when your child, when it comes to going to the dentist, and once you get them there, is it hard for them to relax? Well, with me now on the OHSU Effect is Dr. John Engel, the Director of Pediatric Dentistry at the OHSU School of Dentistry. Good morning.
Good morning.
So kids are never wild about going to the dentist. So what does the OHSU School of Dentistry teach its students about caring for these patients who may be scared or nervous?
Well, I think the first thing that we try and do with our dental students prior to the time that they even enter into the clinic or do any clinical training is that they have a fairly broad-based background in child development, child psychology, and just the interactions with the child. And sometimes it's easier if the students are simply working with the child because a lot of the anxieties or things that you referenced, coming from the parents or coming from society. And it's always more fun to have a one-on-one relationship with the child.
You mentioned that a lot of the fears a child has kind of comes from the parents. So what are your tips for parents on how to ease those fears for themselves and for their child?
Well, if you go to the studies and you look at the traditional maternal anxiety scale, and anybody better based in psychology than I would have a lot of background about that. I think that the biggest thing that you could say for a parent would be that follow the guidelines of like the American Academy of Pediatric Dentistry or the American Academy of Pediatrics, where the children would have a dental home is the term that they use. And it's no more, I guess it's along the lines of having the well baby checks that you might have with your pediatrician, because the majority of the troubles that kids get into from a dental standpoint are preventable. And so if we see the children at a 1-year age, the 18-month, the 2-year age, almost all of those are preventable. And so that just reduces that sort of need for any sorts of extensive dental care.
So how has dentistry evolved to make it less traumatic for kids? As adults, we can kind of do the sleep dentistry thing, but I assume that's not recommended for the little ones.
Well, now, if you're talking about little ones being the small children, and the classic term there would be early childhood caries, and those would be the children at 1 year, 18 months or 2 years old, they certainly have options like that.
Oh, okay.
And the biggest cause for that is just extended nursing or bodily use patterns with the kids. Now, the residency program that we have up there, we have 9 residents presently, and they come back after dental training for a 2-year residency program. They work both in the dental school and up at Doernbecher Children's Hospital. And in any given week, they probably do a dozen cases. As you referenced it as sedation dentistry, these children would be asleep in the operating room for their care.
Wow. Any other, technologies like that you do use on children? Well,
of course, in an undergraduate student with the dental students, they use nitrous oxide. And within the residency program, we also have different types of oral sedations. And it's real similar to what you referenced about the sleep dentistry, although in children it's a little bit different.
Would you encourage a child to maybe put their iPod in so they kind of drowned out the sounds of the dentist room?
Well, that would be good. On days that I'm in a clinic, or certainly when I had my practice in my office, that would have been hard for them to do because I'm probably the loudest guy in the clinic.
Well, getting kids to brush at bedtime is always a battle, easier said than done. So what tips do you have for parents to get the kids to brush and floss?
I always joked when my son was little, there were 2 ends of that tube that needed attention, the oral end and the diaper end, and it was a lot easier for us to take care of the oral end than the diaper end. So I think if you just look at the fact that you're doing so many things from an infant standpoint, I mean, you're cleaning them, you're wiping them, and the same thing occurs as soon as the teeth come in. It could be as simple as just taking a wash rag or a piece of gauze and just wiping any debris off of the teeth.
And what about when they get a little older and you're trying to teach them to brush on their own?
Well, you get into some discussions then with some of the psychologists as to when children have the dexterity to do that on their own. And the old joke is when their handwriting is better than mom's or dad's, then they have the dexterity to brush their own teeth. So they're going to need some help all the way through. And of course, that's from parent to parent. It's a little bit different. What I consider help at my house may be different than you might.
Sure. What are the most common dental problems that you see in kids?
Dental decay. And if you go to any of the public health studies and you just rank disease processes of our society, that's the number one. So when we talk about a preventive type of program, and I referenced bringing the kids in early, almost all of the problems that we would see in a clinic that would lead up to either the needs for sedation or for the anxiety for the parents are all preventable.
And what about braces? Is there a genetic link here? If mom or dad had braces, Is the kid going to need braces too?
Well, you use the word need, so that again becomes one of those familial things. So I think that the smart aleck answer that I use in the clinic sometimes with the students is that if two parents are both 7 feet tall and they carry an infant in their arms, you're probably going to suggest that they might want to buy a basketball for that child. And yet the opposite would be true. So there are some general growth patterns that you'll see with the kids. And as for the types of things that our society might think of as needs for orthodontic care, there certainly are some functional needs, some growth things, and they would be certainly impacted by genetics. Of course, a lot of the orthodontic care also is just cosmetic.
Right.
What we feel is important for our kids.
Right. Dr. John Engel, the Director of Pediatric Dentistry at the OHSU School of Dentistry. Thank you for being here.
Oh, you're very welcome.